Good afternoon, everyone. We'll begin in about a minute. We're just going to let people get it logged in and oriented for today's webinar. And I thank you for joining us. Welcome to the Institute of Medicine of Chicago. My name is Deborah Hodges, and I'm the Program Manager and Association Manager for the Institute of Medicine of Chicago. So thank you for attending today's webinar, Health Equity in Organized Medicine. I've been with IOMC since 2019. It's always a pleasure to be with all of you, and especially today for today's presentation. So I'm going to orient you just a little bit about today's program itself. Today's session is an in-depth survey report from the American Medical Association on health equity efforts, and also the successes and challenges experienced by organized medicine to advance health equity. And we're very fortunate to have two outstanding speakers with us today that will share their thoughts and their insights and their experience. And that's Dr. Fernando Maio and Ms. Claire Aikens. Both are with the American Medical Association, and they are directly involved in the survey, data collection, and reporting. So to give you a brief orientation of today's session, I'm going to share with you, that we're going to share a little bit about some upcoming programs, conduct the presentation with our speakers, and it will be open for questions and answers after the presentation itself. And then, of course, just a brief closing. So that'll give you an idea of how the flow of today's session. Today's learning objectives of the program are to understand the landscape of health equity efforts in organized medicine, be able to describe the key results of the 2023 Health Equity in Organized Medicine Survey, and also you'll obtain info to describe the successes and challenges experienced by organized medicine to advance health equity that you'll be able to discuss with others and also look to compare to your own activities and organization as a whole. If you're new to IOMC, let me just share a little bit of information in regards to us. The organization was founded in 1915, and it's a nonprofit independent association of distinguished leaders in the health field who collaborate to improve the health of the public. It draws upon the expertise of its diverse membership and regional leaders, and altogether addresses critical health issues through a range of interdisciplinary approaches that include education, research, sharing trusted information, and of course, community engagement. The association itself has accomplished some stellar milestones over the years. And to give you an example of some of those accomplishments, they were involved in developing the broader public ambulance service in the Chicago area many years ago. They fostered collaboration in hiring Black physicians at Chicago hospitals. They advocated for developing a medical examiner office instead of a coroner only. They've also promoted fair housing and homes for the homeless and unsheltered as far back as 1930. In addition, they've also established the African American Health Commission to improve access to care in African American neighborhoods and many other initiatives. Today, IOMC is highly involved in maternal and child health, the social determinants of health, lead pathways and exposure, behavioral health, and more. And this leads us to our upcoming programs that I'm going to share with you. At the end of February, we'll be hosting another webinar on youth and behavioral health in schools. We have three outstanding speakers, Dr. Allen, Ms. Biera, and Dr. Gill will be talking about youth mental health issues in schools. They'll be bringing you information from Chicago Public Schools and other private schools as well. So that'll be an upcoming webinar for you to join us. Also, we'd like you to save the date on June 30th, 2024 this year. It'll be IOMC's annual Healthcare Awards and annual meeting. This event is the largest fundraiser of the IOMC for the year. It's open to all members, fellows, and guests. It'll be held at Mangiano's Restaurant. It's a 3-hour event with plenty of networking and also a great celebration for the 2024 Healthcare Awards. You do not need to be a fellow or a member in order to nominate someone for any of the healthcare awards. And that information can be found on the website. The awards portion of that will be available at the end of this month, which is tomorrow or sometime this week. So please check the website for more information, in regards to that activity. So now what you really came for, which is this presentation as a whole. I'm so proud that we have two great speakers here today to talk about this particular topic. So I'm going to introduce Dr. Maio, and then he'll introduce Blair, maybe you're going to be a doctor soon. I could be foretelling the future there. So you never know. So Dr. Maio is on our board of directors. He is a fellow. He has presented at IOMC a few times. He's done a marvelous job. I'm going to share just a few facts about him, and you can look at the website for a more detailed bio on him. He was born in Argentina. He received his BA in sociology and economics from the University of Toronto. He has an MA in sociology and health studies and a PhD in sociology from the University of Essex. His research and teaching interests are primarily in medical sociology and social epidemiology, with a focus on structural violence and social determinants of health. And his work has been guided by the notion of radical statistics, the idea that analysis can be used not to describe the world, but to change the world, which is an incredible thought process overall. He's the author of many articles and books, including Health and Social Theory, Global Health Inequities, and a co-editor of the Latin American Perspectives in Sociology of Health and Illness. And recently he completed a book with Dr. Maureen Benjamins on structural racism and the death gap in American largest cities. He actually presented that to IOMC's members and colleagues. It was a very interesting presentation overall. He's also the founding co-director for the Center of Community Health Equity, which was founded by DePaul and Rush University in 2015. So as you can see, he's an excellent speaker for today's topic in order to guide us through that. So at this time, Dr. Maio, I'm going to defer to you and Blair in order to take over the presentation. So welcome.
Awesome. Thank you so much, Deborah. Very kind introduction. Indeed, thank you to IOMC for hosting us, in my case, again, to present. I really enjoyed last time with Maureen talking about unequal cities, but it's an equal pleasure this time to be here with Blair, who has her own distinguished background and career to present this amazing work that we've been doing on the Health Equity and Organized Medicine Survey. Really, the goal of the presentation will be to share some of the data of the report, give you a sense of what's in the findings. But we actually published the report in November. It's freely available on the AMA website. I think IOMC has also very kindly added it to your website, and I think we included the PDF in the invite to this talk. So you'll have the full report available to you. And I want to emphasize that it's also a really exciting time as we are collecting the second year of data right now. So if there's anyone on the call from a state or territorial or medical specialty association, consider this a nudge to have your organization complete the survey, please. We all know response rates are really important. Next slide, please. All right. So really the roots of the survey that we're going to describe are found in this document, our 2021 to 23 organizational strategic plan to embed racial justice and advance health equity. For us at the AMA, this was a very important document, an enterprise-wide document that really spelled out our understanding and our approach to health equity work, all building to this vision that I want to pause on for a minute because it really is the grounding for this work, right? A nation in which all people live and thrive in communities where resources work well, where systems are equitable and create no harm nor exacerbate existing harms, where everyone has the power, conditions, resources, and opportunities to achieve optimal health, and where all physicians are equipped with the consciousness, tools, and resources to confront inequities, dismantle white supremacy, racism, and all forms of exclusion in their systems. And really, there are activities building on this vision underway across the AMA. Next slide. All of our activities have really been kind of structured across these 5 approaches. The idea of embedding equity within our systems and policies and practices, building alliances and sharing power, ensuring equity and innovation for marginalized, minoritized people and communities, pushing upstream to address all the determinants of health, including the ones outside of the healthcare system, and fostering truth, reconciliation, racial healing, and transformation for discriminatory and exclusionary past. And there are activities underway in each of these areas, within each of these approaches, within the AMA. But that's a separate report and a separate presentation we could give. I think in this one, what we're trying to highlight, what we're trying to learn from really, is the activities that are underway across the country in medical associations. And here we're specifically talking about state and territorial associations and medical specialty associations that form the AMA Federation of Medicine. That's really our focus today. Trying to understand where the Federation of Medicine is at, where organized medicine is at in terms of their work on equity. Next slide, please. So within our strategic plan, we committed to many things, including this, to build our AMA's capacity to understand and operationalize anti-racism and equity strategies. A big part of that is about learning from our partners across the country. What work have they started? What have they prioritized? And how can we as a national organization support? What kind of tools, programs, training could be helpful to physicians and their medical associations? How can we, for example, to use the language of the slide, normalize conversations around racism and other forms of oppression as primary drivers of health inequities? How do we go from that being an academic discourse to an actual applied institutional effort, right, that we see manifest in programs and policies? Next slide. As one example of products or tools that we have rolled out is this one, our guide to language, narrative, and concepts. It's a collaboration between us at the AMA and the IOMC Center for Health Justice. It is an example, right, of a tool with which we can nurture conversations around racism, but really all systems of oppression and marginalization. And we continue to develop products like this. But we know that it's not enough just to publish, just to produce things, right? We want to enter into conversations, right, with our partners, the users of these products. We want to create systems that help us gauge the effectiveness and impact of these tools. So why not ask our primary audience? And that's where this survey comes in. Next slide. And Blair's going to walk us through the data. What we did is we reached out to our partner organizations, state territorial associations and specialty associations, and asked them a set of questions derived from the actions of the Rise to Health Coalition. Ideas of getting grounded in history and local context, identifying opportunities for improvement, making equity a strategic priority, taking initiative, and aligning, investing, and advocating for thriving communities. And the data, I think you'll agree, are really interesting, showing a lot of variability. Yes, some success stories, and we've tried to highlight those in the report, showing progress as this headline affirms, and also areas where we can continue to work together, right? Coordinate efforts and support work, so it's more sustainable and effective in the long run. So before turning it over to Blair to really present the bulk of the data, 2 very quick points. One is on the next slide. What do we mean by organized medicine? This is really a way of acknowledging the power that organizations offer physicians and trainees as a collective platform for advocacy and support. Right? We recognize the power that medical associations, including the AMA, have to influence policy and even shape narratives around health and health equity. And the second point is something about the timeliness of this data and this discussion that we're having today. I think we would all agree that there's a great deal of urgency around health equity across the country. Many organizations have invested in this, have hired teams, often reporting to a health equity officer. Others have started DEI efforts and a wide range of programs and initiatives. But the time is really important, right? The context really matters. And it has to be said that in many parts of the country, work of this type is under attack. It's critiqued in many places, banned in some places. So we see pushback and resistance. We see perhaps even doubt about the effectiveness and utility of equity work in many places. We also see high expectations across the board. And I think that's often a failure to recognize that health inequities are so deeply entrenched in our systems, in our society, that they will not be eliminated overnight, right? Despite the best intentions of people and institutions. So for me, all the more reason to take stock of what is happening across the country, particularly medical associations. What's happening? What are they working on? What are they prioritizing? What needs do they have? And what kind of support are they calling for? An opportunity for all of us to learn from the activities that are underway, support and coordinate that as much as possible. All right, so with that opening, I'm going to turn it over to Blair to walk us through the actual nitty-gritty of the survey. Thanks, Blair.
Thanks, Fernando, for setting that up. So as Fernando mentioned, so this is going to be an overview of the key highlights of our first health equity and organized medicine survey that was administered in January of last year. And we've collected some really valuable data in this first year of the survey and had really good communications and processes with the Federation of Medicine as a whole. So we're pleased to provide you with just some key highlights from the survey, and we're really looking forward to the continuing of this work for years to come. Next slide, please. So this is the first time that we collected data in this way from the Federation. So our goal was to understand progress towards health equity across organizations while generating data on specialty societies and state associations efforts. So we sought to identify specific actions that organizations were taking or contemplating taking, as well as to gather data on promising initiatives, or what we are calling action insights, and identify barriers to the equity work as well. Next slide, please. Before moving on into the real details of the survey, I want to start with sharing a little bit of information about the response rate and the survey process itself. So in January of last year, the Health Equity and Organized Medicine survey was sent via email to all organizations in the Federation. And organizations completed a web-based survey, and we had some follow-up discussions with select organizations to gain a greater understanding of their work. So, of course, a special thanks to the Federation organizations that completed this first year of survey collection. And also just want to acknowledge that this was our first time doing this. So we definitely learned some lessons along the way and definitely understand the possible bandwidth or capacity issues that organizations might have had. And we use this as a learning time to learn about how to best communicate and do a survey like this. So we had 84 organizations complete the survey overall. And so we had a good response rate of 58% among state and territorial associations, and a modest response rate of 26% among specialty societies. And so in the full report, you'll notice that the results the results are both stratified by state and territory and specialty society if you're interested in seeing the differences between those organizations. And then we only had about 6% of county organizations complete the survey, and that could be due to various reasons, including capacity issues. And so for that reason, we decided to exclude county organizations from the quantitative component of the analysis. Next slide, please. So we organized the survey around key actions to advance health equity from the Rise to Health Coalition, a national coalition for equity in healthcare, which the AMA launched last year in partnership with the Institute for Healthcare Improvement and other national partners. So this survey was an exciting first step in understanding the current work of the current landscape of equity work among professional societies, which are one of the focus areas or pillars of the Rise to Health Coalition. So on the graphic on your screen, it shows the 5 action steps of the Rise to Health Coalition to transform healthcare through coordinated and collective actions to achieve health equity. So the results shown on this slide and throughout the coming slides are combined results from specialty and state associations. So the survey found that the number of actions completed by organization varied by step. So for example, you could see that 74% of organizations have taken at least one step to get grounded in their local history and context, while only 16% of organizations have completed an action or working towards at least one action to identify areas of improvement. Next slide, please. So the first step towards taking action to advance health equity is getting grounded in your local history and context. And this is a vital step of the coalition and a vital step of health equity work overall. And so you could see we found some very interesting results here. So 37% of responded organizations identified historical harms related to their organization's policies and practices, and 18% of organizations actually publicly acknowledged their organization's past harms. And this often took various forms for published articles or statements on a specific organization's website. And then, as you can also see, more than a quarter of organizations took action to address current or past harms. Next slide, please. So here, just taking a little bit of closer look at the organizations that publicly acknowledge their organization's past harms. So as part of getting grounded in your history and local context, it's important to examine, acknowledge, and address past harms in order to have collective healing. So here are just a few examples. We really wanted to promote and showcase the work that these organizations went through to make these public acknowledgements of their organization's past harms and how they're learning and growing from that. So I'll pause for a minute, if folks would like to take a look at some of these public statements that organizations made. So another part of getting grounded involves investing and understanding your local community, including the assets and strengths of your community, as well as understanding the challenges that members of your community experience. So as you can see, 50% of organizations indicated that they were working towards doing this. And so throughout the full report, we share qualitative stories through sections called Action Insights. So I'll highlight a few of those throughout this presentation. So here we have an action insight from the Michigan State Medical Society. And the Michigan State Medical Society had health equity regional summits throughout the state to get a better understanding and learn about the health equity landscape across the state, and really to understand the distinct challenges that different regions in their state have as working towards health equity. Next slide, please. So after you get grounded in your local history and context, the next step is to identify areas for improvement. And so one of the most promising indicators in this step is how an organization stands in relation to gathering, collecting, and stratifying key quantitative data regarding their organizational membership and socio-demographic factors. So we can see here that about 36% of organizations are working towards this, and almost 8% of organizations indicated that they already achieved this. And so here we have an action insight from the American Association of Clinical Endocrinology, in which they had a membership DEI survey where they collected various information, including different demographic information, race, ethnicity, age, sexual orientation, and gender. And they really used those results from that survey to plan and inform their upcoming DEI efforts, actions, and initiatives. So another aspect of identifying areas for improvement involves gathering qualitative data to understand the full scope and context of inequities that an organization is facing. And we can see that about half of organizations indicated that this is something that they were working on as well. So after identifying areas for improvement, the next step, step 3, involves making equity a strategic priority. And so, in the report, we asked about several different actions that organizations were doing in this space, and I'll highlight a few here. So one is organizational assessment of their budget model to ensure health equity. And so we can see that about 46% of organizations indicated that they had achieved or working towards or planning this. We can see that a significant portion, 43% of organizations indicated that this is not something that they had considered working on in this time. But we did want to highlight an action insight from the American Thoracic Society, in which they made they integrated health equity as a strategic pillar into their strategic plan. So this made it easy for them to incorporate health equity related activities and initiatives into all areas of their budget. So another indicator that we looked at when thinking about making equity a strategic priority is we asked organizations about committing to paying all their employees and contractors a living wage. And majority, 60% of organizations indicated that this was something that they had actually already achieved. And this was and the most achieved indicator or action from everything that we asked about in the survey, which is really great. And so here we have an action insight from the American Society of Hematology. And what they do is on a regular basis, about quarterly, they review all their employees' compensation by a number of different factors, including career level, race, ethnicity, and gender, to assess to see if there are any inequities in pay and to resolve those inequities. So after making equity a strategic priority, the next step 4, is to go ahead and take that initiative. So here, one of the main indicators that an organization has taken initiatives is we're measuring the organization's efforts to dismantle harmful race-based clinical algorithms and decision tools that incorrectly use race as a proxy for genetic or biological ancestry. And we can see that 50% of organizations indicated that they were working towards this or had already achieved this. So here we have an action insight from the Medical Society of Delaware, in which they passed a resolution that helped them to work towards supporting organizations and eliminating the race correction factor and the kidney function calculations. And so they contacted all of the labs throughout their state to make sure that they were informed of this new calculation and help them to convert to using that. Next slide, please. So another part of taking an initiative involves collaborating with staff to revise practices around policies and policies guiding hiring, promotion, advancement, compensation, and mediation to achieve equitable outcomes. And we can see here that similar proportions, about 40% of organizations indicated that they had achieved this or were working towards this. So finally, the 5th step in the Rise to Health initiative involves advocating and investing and aligning for thriving communities. And so here, this step is closely connected with the AMA push upstream strategic approach that Fernando mentioned at the beginning, which aims to address root causes of inequities. So here we can see that 50% of responded organizations were working towards addressing root causes and inequities by leveraging organizations' unique assets and strengths to address social and structural drivers of health. And so here we have an action insight from the American College of Radiology and the Radiological Society of North America, which they're a part of a radiology healthcare coalition, which brings together different advocacy groups and partner organizations to really positively impact and learn from each other to improve health equity in the radiological space. So another aspect of aligning, investing, and advocating for thriving communities involves engaging in collective advocacy to address root causes of health inequities. And over half of organizations, 50%, indicated that they were involved in these collective advocacy efforts. So an action insight we have here comes from the Travis County Medical Society and the Texas Medical Association, who they work together with other advocacy groups in their state to advocate for maternal health legislation and release of the Texas's most recent maternal mortality data by Texas Department of State Health Services. So overall, we found really remarkable variability in the results of the survey, as we know and understand that organizations are all in various stages in collecting this work. But by doing this first year, this survey, we now have a better understanding, both of the quantitative data and qualitative stories on exactly where associations are in this work. We have a better understanding of the current landscape and can learn and understand what is needed to help organizations move this work forward. And so here on the screen, you'll see a QR code, which will take you to the full report that has all the findings from the survey. And so some of the things that you'll find in this full report is more of these action insights and stories from the work that organizations are doing, as well as stratified results by the different organization type and some list of AMA resources to help advance this work. And so, as Fernando mentioned, this was our first time doing this survey, and we're in the process of doing our 2nd year of data collection right now. So just continuing to learn and help these organizations throughout this process. So definitely want to thank you for having us here today and open up the floor for questions.
So at this time, if you could place your questions in the Q&A box, then Dr. DeMaio and Blair can address them. So in the interim, I thought I would ask a couple questions. Obviously, there's a lot of lessons that were learned. This was your inaugural survey. What are you doing differently from last year's study to this year's study?
Yeah, that's a really great question. So one of the things that, this is our first time reaching out to Federation organizations in this way and conducting a survey this way. So one of the things that we were working on and expanding on is really the best way to communicate with these organizations and how to get the word about the survey out there. So one of the things that another reason that we created the report is to kind of share out what we learned and hope to engage organizations for upcoming surveys. So this year, so they kind of see and build up some credibility around what we're doing and why. And so we've also incorporated some different outreach tactics to reach out to organizations to encourage them to complete the survey, as well as asking a few different questions.
Okay.
Yeah,
Also, go ahead,
sorry.
Go ahead, Dr. DeMaio.
Thanks, Deborah. Yeah, if we can just follow up on Blair. I think part of the learnings from this year is really how valuable the qualitative stories are as well. I think we knew that, of course, but just seeing how important it is for organizations to be seen and heard and recognized for their work has been actually profoundly moving, and validating, right? As people launch programs and launch initiatives, as they weather doubts or attacks in some cases, being able to see their programs in that broader landscape, I think has been helpful to people. And I think will help us in the next round of data collection as well. No one likes to fill in a survey, but people like to feel part of a story, right? And what we're doing with the survey is telling the story over time of what initiatives are being launched. If we track over time, over 5 years, say, we'll have a really in-depth look at how medical associations in this case, what they've prioritized, what they've deemed effective, and perhaps even what effect these programs have had over time. That's the big goal. And I think
Yeah.
as moving towards that, we'll get a better and better response rate.
Yep. And I'll just add to that too, by sharing the stories too, it's an opportunity from organizations to learn from each other and see that it is possible, what some things are possible to do in this space.
Yeah, definitely. So are there any dominant themes or actions that you noticed in the current survey itself that were maybe more surprising than what you thought?
Yeah, I mean, I think I was surprised and encouraged to see how many organizations indicated that they were working towards these things. Like I don't think we really, this was our first time doing this, so we didn't know exactly where organizations are. But I found it really encouraging to see that, maybe they weren't all working on everything, but a lot of organizations were thinking about things. We had steps planned that they maybe hadn't taken or indicated that they were working on most of these actions. I think we probably had the most actions that organizations indicated that they were doing in the space of making equity a strategic priority. So that was really exciting and encouraging to see as well.
Mm-hmm. Now, today you shared part of a part of your report, obviously not the full report. Are there specific initiatives in health equity that are being done by many organizations that you noticed in your survey?
Yeah, that's a really good question. There's really a wide variety of the work. And organizations are doing a lot of different things, from advocating or partnering up with other organizations. I think that was another thing to see that was encouraging, is that seeing organizations come together to do some of this work. So, like with Texas, having a local county organization partnering up with the state medical association to come together to advocate and really help advance health equity in the maternal space in their work. I felt like that was really encouraging to see. And there was kind of a few other examples that were written in of organizations coming together to do similar work.
Very good.
Deborah, if I could, I see a couple of questions in the chat, and it'd be great to explore those. I see one from my good friend Maureen Benjamin. Hi, Maureen. Um, and Maureen asked, do you think this paints an overly optimistic picture given potential differences in those who did not respond? A very thoughtful question, and one that we've thought a lot about. The map that Blair mentioned at the beginning of the presentation for us was quite important. We do have some responses from all parts of the country. So it wasn't just the associations that we would beforehand consider to be more progressive or more equity focused. We have some good responses from the Deep South, from Southern delegations, from the Southern associations, which we think is really quite important, and quite a lot from the Midwest, really all parts of the country. So I don't know how big of a problem that is. I think we're going to compile wave 1 and wave 2 results, and that will help bolster the response rate even more. And hopefully we're reaching more and more parts of the country. And then trying to pull as many of the qualitative stories from across the country as possible. So it's not just the stories from the associations that you might predict beforehand being more progressive than others. Blair, is there anything that you'd add to that?
No, yeah, I think that's exactly right. Like as we pull these 2 years of responses together, after that we can probably have a better sense and do a better assessment of the non-response and look into that a little bit deeper before progressing to year 3.
There's a question here from Scott Tomor. Any thoughts about doing some qualitative follow-up, in particular, useful maybe to learn about organizations, what they've reported and already achieved in their equity objectives?
Yeah, thanks. That's a really great question. And I think doing the qualitative, pulling out those stories is a really key piece. And that was kind of what we were trying to get at with the action insights. And I think something that we'll continue to do is try to pull out and really understand the work and the stories that these organizations are doing to highlight them here. Because I think seeing that and seeing what an organization is actually doing is helpful for everyone and easier to learn from.
Yeah, just following up on that, we're also taking the approach of the survey report being like the descriptive findings of all the data that we have. And then for some of the topics, we're taking a deeper dive in a dedicated article. So there's one that's forthcoming now on the harmful race-based clinical algorithms, where we're able to go into a bit deeper depth into the data, into the qualitative examples. And we want to do the same thing with the public acknowledgements of past harms. There's a great deal of qualitative data, the actual transcripts themselves, the actual statements themselves, that we can analyze, I think, in a kind of an interesting way to kind of document how organized medicine met the moment in 2020, 21, 22, what we've promised, what we've committed to, and then over time, what actions have kind of followed through from that.
Mm-hmm. There's a question from Steve. How much pushback have you encountered regarding health equity?
I think we're seeing everything that you're seeing as well in the news, in our politics, and in scientific debates, all kinds of pushback. The broad spectrum from organizations and folks who would go much faster, much further in this work, to others who don't even want to write the word racism in their publications or don't want to accept the fundamental problems that we see in our society, the visions of inequality, of oppression, and marginalization. So the pushback we think is really quite severe, quite important to acknowledge. But I don't think that's stopping the work, and certainly not stopping the work of our team and the AMA overall. We're aware of the pushback. We probably expect it. You know, that's how white supremacy works. That's how systems of oppression work. They defend vested interests. So the pushback is perhaps a sign that we're on the right track, that we're asking the right kinds of questions and pushing for the right kind of strategies to make this a fairer country.
Definitely. So both of you have a lot of experience in this. So from sociologists and social epidemiologists, how can we walk away from this presentation today and what are the questions to raise in our own organizations of how to move forward?
Yeah, great question, Deborah, because it really is about institutional change, right? It's not just about our individual best intentions or attitudes. Those are important and they drive a lot of our work. But the true sustainability is what change can we make at our institutional level, changing bylaws, changing systems, changing priorities, and how those track over time. So here, of course, as a medical association, we are focused on medical associations, but there's parallel work that's happening with public health departments, that's happening with health systems, that's happening in other aspects of healthcare. Really, all of us can take a survey like this and kind of ascertain where our organization sits in that broad spectrum of work.
Mhm. Most of your work, if I'm correct, and correct me if I'm wrong, either one of you, of course, on the Federation of Medicine, are most of the responses from the participants who are a part of the Federation of Medicine?
Yes, so the survey went out to all of the organizations that are part of the Federation of Medicine.
So so with that in mind, how can other organizations who may be attending today or who are going to watch this video away from this, how can they find out more about the Federation of Medicine and participate in this survey that you have going on right now?
Yeah, that's a really great question. I'll start, and Fernando, you can feel free to jump in of anything that I am missing. So, um, so I'm not actually not exactly sure of the process of joining the Federation of Medicine, but that is comprised of all the state and specialties that make up the House of Delegates for the AMA. And so if you are or you're a member of any of these organizations, you can encourage your leadership at these organizations to ensure that they complete the survey so the important work that you're doing can be captured and we can report it back out.
Yeah, thanks, Blair. And maybe, Deborah, your question really gets at how different organizations interact with medical societies in the area. So those of us in Chicago, how we interact with the Chicago Medical Society, or how we interact with the Illinois Medical Association, how we interact with regional associations, and how our institutions interact with them. I think that's probably the most viable path to just somehow influencing the data that we then collect here, how our organizations partner with that infrastructure.
Mm-hmm. Well, one final question, unless someone else has any other questions or comments that they would like to share who's attending today. So what should we be doing to move things forward? Small organizations sometimes are seen as maybe not having adequate resources, but then again, they may be more nimble because there's less people at the table. But that isn't always the general rule. Large organizations like the AMA and many of the state associations, they have a lot of resources, at their fingertips, or they can acquire it. So is there anything that you can suggest that people should do, organizations or associations should do from your backgrounds as sociologists and as experts in this area?
I think the fastest part of the answer, or Blair, jump in if you like, but the fastest part of the answer would be to join a collective, right? Not to do this on your own. The Rise to Health Coalition is one example of the way that health systems, individual practitioners, community-based organizations, health systems, pharmaceutical companies, the whole gamut of healthcare ecosystem can work together because the goal is to have like coordinated and aligned action that's sustainable over time, that weather storms that will undoubtedly come and is sustainable past the individual charisma of individual people, right? So again, it's about systems and institutional change, and that seems to work best in coordination with others. But I'm sorry if I interrupted. Please go ahead.
No, I was gonna agree with what you said. It's about all everyone in all these organizations coming together, because this is not one thing that one single organization can take on all on their own. Just like the AMA, we can't take on and solve health equity all on our own. That's why we, the importance of collaboration and working together to make these system level changes.
Mhm. And your comments align greatly with comments that we heard at a recent convening that the Institute of Medicine of Chicago held last month. On December 14th, IOMC held its 9th State of Health of Chicago, which really encompasses Illinois, as well. And one of the comments by one of the panelists was that there are 800 organizations in the state of Illinois alone that are working on some area of health equity or healthcare equity, well-being, or social determinants of health. So the solution may not be in starting a new organization or foundation, by coming to the table and finding ways to work together in order to solve the problems that many people are trying to solve, at once. So your comments today in your presentation is affirming those comments as well. So we appreciate that. And we appreciate the attendees who attended the State of Health of Chicago as well. So thank you both for your presentation today and the findings. The report is on from today's presentation is IOMC's website. If you have any questions or cannot find it, just contact the IOMC office as well. I just want to remind everyone to look at the next upcoming webinar that we're going to be discussing youth and behavioral health in schools. We would love for you to join us. You do not need to be a fellow in order to join our webinars. They are open to all people. And then, of course, save the date for the annual Healthcare Awards event that'll take place in June. And consider a leader, a colleague, a friend, someone in order to nominate for the Healthcare Awards. There are about 7 awards that are honored at that event. So we'd love to hear from more of you all together. So thank you both, Dr. DeMaio and Blair Aikens, for sharing your information with us today. And we wish you well in your survey that's going to be conducted, being conducted right now. And I understand that takes several months in order to put together. So I anticipate the next report will be in November, like it was this past year. So we're honored to have you with us today. And please feel free to reach out to the speakers. If you do not have their contact information, feel free to contact the IOMC office, and we'll be more than happy to connect you with them. So have a good day and a good week, everyone. And we hope to see you at the next IOMC event. Take care.